Hello, good afternoon or good morning, depending on where you are in the country right now. I'm Shelley Nasso, and I'm CEO of Cancer Nation. Thank you for joining us today for our virtual symposium. We started doing virtual symposium or symposia in 2022 when we came back to in-person symposiums, and we knew that not everybody could travel to be here or spend the time away from work to participate in a 2-day meeting, 3-day meeting really. So we wanted to have a session where we can share policy and advocacy updates, health updates, ways that you can take care of yourself as a cancer survivor, as well as mental health updates and advocacy. So we have a really great program designed for you today over the next 3 hours. And I want to thank the Cancer Nation team for putting this together, particularly Veronica Paniotu, who organized the whole session, and all of the team who really helped promote it and help us identify speakers. We have a wonderful team, and I'm really grateful to work with each and every one of you. I also want to thank our sponsors who make this possible. Before we get into our first session, which is on policy and what's going on in DC and how we need your help, I wanted to just take a moment because we obviously changed our name this year to Cancer Nation, and some of you were with us in person in DC when we announced the new name, and some of you were not and were able to see the emails, but I wanted to share with you a short video that really explains why we made this change and who we are, and it's kind of our manifesto for what we care about and how we're going to be bold in advocating for the 18 million cancer survivors in this country. So I'm going to take 90 seconds to share, and Zach's going to share with you this video, and then we'll get into our first session.
We are Cancer Nation. We are healthy. We are sick. We are strong. We are suffering. We're in every town, in every family, in every heart. We are the 18 million Americans living with, through, and beyond cancer, and we demand the right to thrive. Today, cancer is not just about how long we survive, but how well we live. The very treatments that save us can alter our healthcare needs forever. Cancer can change our bodies, destroy our savings, mess with our minds, or return when we least expect it. Cancer is a journey we travel for life, and how well we live that life depends on the care we get and the policies that shape it. We need a cure for care. That means each and every member of Cancer Nation gets whole person cancer care, survivorship care plans, and financial protections. Nobody gets a vote on whether or not they get cancer, but everybody gets a vote on how we live with it. We are Cancer Nation, and we are here to be heard. Join us.
Thank you, Zach. I still get chills when I hear that video, and we've been really grateful for the positive feedback we've heard from so many of you about this change. And I know it takes time to get used to change, and we still have a lot to do to help make sure that everybody knows about our new name. But I hope that helps you understand our goals and why we're here and why we're Cancer Nation. Before we get into the policy and advocacy section, I wanted to make one more logistical comment, which is we will send out the recording after the fact, including slides for any of our speakers who have slides. Not everybody does, but we have several presentations that will have slides, and we'll be sure to share that with you as always. So next, we're going to talk about policy and what's going on in Washington, D.C. and where we need your help. So those of you who came to DC in June and were on the Hill with us know we were advocating against the One Big Beautiful bill because of the severe cuts to Medicaid, and we were advocating for research funding. We were not successful in stopping the One Big Beautiful bill, which passed and is facing a lot of, anger from some people, and we are still really figuring out how is that going to impact our constituents and what we can do to help protect them. The other topic of our advocacy was research funding, which is still going on right now. The excuse me, the appropriations um, we have a funding deadline of September 30th. So we're going to talk today, though, about the healthcare tax credits that need to be reauthorized in order to help people who buy their healthcare plans on the Affordable Care Act exchanges, whether it be their state exchange or healthcare.gov. These healthcare tax credits make the policies affordable. And if Congress doesn't extend them, then prices will go up, premiums will go up for plans, and it'll make it out of reach for many people. So we're going to start with hearing from Edwin Park from Georgetown University, and he's going to walk us through the tax credits, how they work, and what this change would mean if we don't get these reauthorized. And then after Edwin, we're going to talk with Allison Anway, who is a partner with Ballard Partners, and is going to give us a lot of the inside scoop on what's happening on the Hill and how we can make an effective case when we're talking to members of Congress about this, because we're going to ask you to make calls to your members of Congress and tell them why this is so important. And Andrea has prepared a fact sheet that's going to help you with information and talking points about that. We are part of a coalition of advocacy organizations in cancer and all different health organizations called the Partnership to Protect Coverage. And Andrea has been on the Hill and meeting with lots of congressional offices about this as part of the partnership. And also Edwin and his team at Georgetown serves as policy advisors and really helped with the policy analysis for the partnership. And so we're really delighted to have him here today. I'm not going to go into detail about his bio because we will put that in the chat because I want to make sure he has enough time. So welcome, Edwin. Thank you very much for joining us and sharing your expertise and what we need to know about these healthcare tax credits.
Great. Thank you, Shelley. Thanks for the introduction. Hopefully the slides will be popped up or unless I need to share those. Oh, there we go. Perfect. So I'm with the Georgetown Center for Children and Families, which is a research center located within the McCourt School of Public Policy at Georgetown University. We focus on healthcare coverage and access for low-income children and families. And we have been tracking all the developments with the Budget Reconciliation Law, HR 1, or the One Big Beautiful Bill, and its draconian Medicaid cuts. But also, we've been tracking the scheduled expiration of enhanced premium tax credits, which help people afford coverage on the ACA's marketplaces. Next slide. So just as background, before we talk about the policies, issues, the politics of the enhanced premium tax credits, just want to provide a level set looking at what the Budget Reconciliation Law did related to the marketplaces. So it didn't get a lot of attention. Obviously, the lion's share of the Medicaid and the total healthcare coverage cuts were due to nearly $1 trillion in cuts to Medicaid and the Children's Health Insurance Program. But there are significant cuts to the marketplaces, which will affect the ability of people to both afford and access marketplace coverage. So there are about $213 billion in marketplace cuts. Didn't get as much attention as I mentioned. These are cuts that restrict eligibility for certain immigrants. It eliminates the ability of people to auto re-enroll in a new plan every year, which would make sure there's a smooth transition. Provisions that affect temporary eligibility while problems determining eligibility are resolved. It removed caps on repayment if your income turns out to be higher than initially projected by an individual or family. There were limits on how much you might have to pay back in premium tax credits if your income turned out to be higher than expected. It also got rid of a special enrollment period to allow low-income people to enroll over the course of the year in the marketplace. So these provisions, add up to about $213 billion in cuts to current marketplace spending. If you look at the total cuts to Medicaid, CHIP, and the marketplace, accounting for interactions among all the provisions, it's more than $1.1 trillion in cuts over the next 10 years. Next slide. And this will result in big increases in the number of uninsured. So you can see here on the graph on the left, according to the Congressional Budget Office, there'll be an increase of a little over 1 million in the number of uninsured relative to prior law in fiscal year 2026, which starts October 1st of this year, but eventually it'll rise to about 10 million more uninsured in 2034. And so you can see pretty significant increases. This is the largest rollback in health coverage in history. We have had pieces of legislation that cut programs like Medicaid that do increase the number of insured, but never to the extent of this legislation. If you look at the breakout, as one would expect, because the Medicaid cuts constitute, the large share of the total cuts to healthcare programs, Medicaid and CHIP enrollment, the number of uninsured will be about 7.5 million more due to those cuts to Medicaid. But there are about 2.4 million more people who will be uninsured as a result of the marketplace cuts. And so you can see that it's about 25% of the total increase of a 10 million in uninsured are due to those marketplace cuts that are in the budget reconciliation law. Next slide, please. But these increases in the uninsured don't even account for the scheduled expiration of the so-called enhanced premium tax credits. So the Affordable Care Act, as you know, included tax credits, subsidies to help people afford marketplace plans. But in 2021, in response to the pandemic, under the American Rescue Plan Act, these subsidies were further enhanced, became more generous to increase affordability and to spur greater enrollment in the marketplace. Those enhanced subsidies were originally scheduled to expire at the end of 2022. They were subsequently extended in the Inflation Reduction Act, which was enacted in 2022. So now these enhanced subsidies are scheduled to expire at the end of this year. So after December 31st of this year. Now, what are some of the enhancements that were included as part of the American Rescue Plan Act? There are three big categories of enhancements. One, a substantial reduction in premiums as measured as a share of income. In other words, the amount of the premium owed by individuals compared to what is subsidized by the federal government, compared to the baseline ACA subsidies. For those below 150% of the federal poverty line, there's a zero premium, so that the federal government picks up all of the costs of marketplace plans for those with the lowest incomes who are eligible for the marketplace. Finally, the tax credits were extended in terms of eligibility above 400% of the federal poverty level. So the original ACA subsidies, they're available between 100 and 400% of poverty, but tax credits were now made available for those with somewhat higher incomes, so that those, particularly those who were previously purchasing marketplace plans entirely at their own cost, were going to get some subsidies through these enhanced subsidies. As a result, 93% of enrollees now in the marketplace currently receive some subsidies due to either the ACA's underlying subsidies or these enhanced premium tax credits that were originally enacted 4 years ago. Next slide. So how important, or to give you a sense of how vital these enhanced subsidies are, you can see from our colleagues at our sister research center, the Center on Health Insurance Reforms at Georgetown, what the share of one's income that has to be paid in premiums are by different income brackets under both the enhanced subsidies and under the baseline ACA contributions. So you can see for those with the lowest incomes, it was a little over 2% of income, but now it's 0% of household income that's owed in marketplace premiums. And then all the way up to 400% poverty and above, where there were no subsidies, but now subsidies are limited, are available to reduce the premium to 8.5% of a household's income. So you can see here quite a big difference in the generosity of subsidies under these enhanced premium tax credits. As a result of these enhanced premium tax credits, 80% of current marketplace enrollees can now buy a plan for $10 or less per month in premiums. So it's quite a substantial step forward in making marketplace coverage much more affordable if you're in the income range, above Medicaid eligibility, whether through the Medicaid expansion, for example. Next slide, please. So you can look here under estimates for the Urban Institute what the enrollment impact of the enhanced tax credits are by income. So you can see here, for those with the lowest income, there are 1.4 million more people who are expected to be purchasing marketplace plans as a result of the enhanced tax credits, the lowest income levels, those below 150% of income, who are now able to buy a premium and have a premium of no cost. But even above 400% of poverty, you can see 1.5 million more people are able to purchase marketplace plans. Previously, they were unsubsidized. Now they're getting some subsidies. But clearly, the enhanced premium tax credits have the biggest impact at the lower end of the income scale, just because of the inability of individuals to pay for marketplace plans with the underlying subsidies. But with these enhanced tax credits, a lot more people can enroll. Next slide, please. As you can see here, under these Urban Institute estimates from last year for this year, you can see the difference between how much people are estimated to pay in premiums for marketplace plans at various income levels. These are annual premiums, but for example, between 200 and 250% of poverty, the premiums are twice as large without the enhanced premium tax credits. So, $500 in premiums for those at twice the poverty line, 200 to 250% of the poverty line versus almost $1,100. And you can see quite a stark difference between those blue bars and the yellow bars. And the yellow bars are, again, where the enhanced premium tax credits are shown in terms of their impact. Next slide. So what has been the result of this? And the result of the enhanced premium tax credits is a doubling of marketplace enrollment. So you can see here, 2014, when the ACA was fully implemented, marketplace enrollment was roughly 8 million people. And that has increased significantly. So it increased to about 12 million by 2020. But once the American Rescue Plan Act was enacted in 2021 with these enhanced premium tax credits, enrollment dramatically increased in the marketplace. So it was a little under 12 million in 2020, and it was sort of a steady state at that point. In 2025, looking at open enrollment, and this allows comparison over time, we're at 24 million people. So essentially a doubling of enrollment in the marketplace. And this is driven principally by the enhanced premium tax credits. There have been other simplifications to ease enrollment in the marketplace that have been done by regulation that are being reversed either by H.R. 1, the big beautiful bill, or other regulations that have been put in place by the Trump administration, some of which have been temporarily blocked through litigation. But the premium tax credits are the big driver of this dramatic increase in enrollment in the marketplace, which in turn has allowed many more people to have coverage, to have assistance with premiums, with cost sharing, and therefore much greater access to needed care due to these marketplace premium tax credits that are enhanced. Next slide, please. So what would happen if these enhanced premium tax credits expire? And we saw the benefit of the premium tax credits on those Urban Institute estimates. But if the enhanced premium tax credits do expire as scheduled at the end of this year and are not extended, then the average premium increase in terms of the premium owed by an individual that's not picked up by the federal subsidies through the premium tax credits, there would be a 75% increase in net premiums on average. And you can see here, obviously, the biggest increases are below, at lower income levels. So for those with incomes below 25,000, according to the KFF, their estimates, you can see it's a 573% increase in expected premiums. And you can see even at somewhat higher income levels, those who make $65,000, it's still a 17% increase because they were getting some subsidies at above the 400% of poverty threshold. Under the enhanced premium tax credits, if they go away, there would be no subsidies. Next slide, please. This is also going to have an effect on individuals who are receiving less subsidies or even continue to have no subsidies. They aren't eligible for subsidy or they're paying for marketplace plans on an unsubsidized basis because the reduction in subsidies will reduce enrollment, and that will also affect the risk pool that is currently constituting, the marketplace enrollment population. And there will be more sicker people because fewer healthy people would be enrolling in the marketplace without these enhanced premium tax credits. KFF reports that the median increase in marketplace premiums will be about 18% according to rate filings by insurers to date. That's consistent with research done by our sister research center, the Center for Health Insurance Reforms, other independent analysts, including Charles Gaba. They all show significant increases in premiums, in part because a worsening of the risk pool, the expiration of the enhanced premium tax credits that are scheduled, and also much greater uncertainty about the impact of the budget reconciliation law and overall in terms of rising healthcare costs are creating an uncertainty among insurers. And so they're all filing for very significant premium increases. And so even though the median is about 18%, you can see that in some cases, there are increases of 50% or more. It's less typical, but there are a number of insurers that have filed rate increases of 20% or more. Next slide, please. Now, what will likely be the enrollment impact of the expiration of the enhanced premium tax credits? There are two estimates I'd like to talk about now. One is from Wakely, which is an actuarial firm that often contracts with insurers. They've done a lot of estimates of the impact of the Affordable Care Act over the years. And they've looked at the expiration of the enhanced subsidies, and they believe that enrollment could fall anywhere between 6 and 7 million due to the expiration of these enhanced subsidies. If you remember, the current measurement of enrollment based on open enrollment at the beginning of this year was 24 million in the marketplace, most of whom are, of course, receiving subsidies. But this would be a significant reduction, at least a quarter reduction in enrollment, possibly more under the expiration of subsidies. You take into account the marketplace cuts that are included in the enacted One Big Beautiful Bill, HR 1, enacted on July 4th, that would be an increase of another, 5 to 6 million And this is somewhat higher than the Congressional Budget Office numbers, but gives you a sense of what the actuaries who work with insurers and others are thinking. And the total enrollment, therefore, could fall in the marketplace nationwide between 47 and 57%, as enrollment could fall by anywhere between 11 million and nearly 14 million. And so, the marketplace enrollment could likely fall by half. So all the gains that we've seen from the enhanced premium tax credits that were enacted in 2021, we've seen since 2020 in terms of how much enrollment in the marketplace has increased, how much greater coverage and access there is, could all be lost as a result of the combination of the expiration of the enhanced premium tax credits and the implementation of the marketplace cuts that are included in the budget reconciliation law. So next slide, please. The Congressional Budget Office has also done estimates. They haven't looked at enrollment in the marketplace, but they have looked at the increase in the uninsured as a result of the scheduled expiration of enhanced premium tax credits. This is not included in the estimates of the budget reconciliation law, that 10 million number, that 2.4 million increase in the uninsured due to marketplace cuts. This is because CBO already assumes the enhanced tax credits will go away because they are required as part of their assumptions, part of the way they do scorekeeping for legislation, because the enhanced tax credits were already scheduled to expire at the end of this year. They assumed it to be already in law, already in their baseline. But when asked by members of Congress how much more uninsured there would be if that expiration takes effect as scheduled, by 2034, CBO has said there'll be 4.2 million more uninsured if this goes into effect as expected. Now, if you combine this increase in the uninsured due to the expiration of enhanced tax credits, combined with the budget reconciliation law, the expected full impact of marketplace regulations finalized by the Trump administration, some of which, again, has been temporarily blocked by litigation. So we're going to wait and see if those are going to take effect as under those regulations. But that will add up to about 15 million more uninsured by 2034. So this really is a direct attack on the huge progress we've made covering all individuals in the U.S. With health coverage that have been made possible by the Affordable Care Act. And it's a big reversal. There'll be 15 million more uninsured by 2034 compared to where we were before enactment of the budget reconciliation law, and if these enhanced tax credits are allowed to expire. Next slide, please. So I'll talk briefly about the politics of the enhanced tax credits, whether they'll be extended. There is an ongoing effort to extend as part of the annual appropriations process. Current government funding expires on September 30th. There's an attempt by a number of members of Congress to try to add some extension. It's probably be very temporary to this appropriations process. There are some House Republicans who just introduced some legislation extending the enhanced tax credits. And the largest marketplace enrollment increases have been in so-called red states. States like Texas, which has seen since 2000 a 3.5 times increase in enrollment in the marketplace. Florida, 2.5 times. So even among, the marketplace enrollment increases have been largest in states that haven't taken up the Medicaid expansion. That is because the Medicaid expansion goes up to 138% of poverty, and the marketplace subsidies available all the way down to the poverty line. And so for those who don't have access to the Medicaid expansion as a coverage source, marketplace plans have been a huge lifeline, especially with enactment of these enhanced premium tax credits. And so that's why non-expansion states like Texas and Florida have seen such huge increases in marketplace plans. Marketplace enrollment for children, for example, has also dramatically increased. It's usually hovered, around 1 million or less. It's now roughly 2.5 million as of the open enrollment period this year in terms of the number of kids enrolled in the marketplace. But very conservative congressional Republican members in both the House and Senate are opposed to any extension. There are efforts by some of the think tanks and advocacy organizations that push for the Medicaid cuts and the marketplace cuts and budget reconciliation are now turning their attention to opposing any extension of the enhanced premium tax credits, arguing that many of the marketplace enrollees who've newly gained coverage over the last few years are actually the result of fraud. They're not real enrollees. And moreover, the focus, particularly among the so-called Freedom Caucus, the most conservative members of the House Republican Caucus, have actually been pushing for more Medicaid cuts and are not open to any extension of the enhanced premium tax credits. And if they are willing to consider an extension, they want it to be paid for. They want the cost to be offset by some of the really structural Medicaid changes that were rejected by House Republicans, like capping federal funding for Medicaid or reducing federal funding for the Medicaid expansion, which is currently adopted by 40 states and the District of Columbia. So that's sort of where we are in terms of politics, but there is seemingly increasing opportunity for some sort of temporary extension, but it is still an uphill battle. But there is more openness on the part of congressional Republican leaders in recent days, especially as we get closer to the expiration of these enhancements. So next slide. I'll just end my presentation and see if there are any questions related to these enhanced marketplace subsidies.
Thank you, Edwin. I have one quick question before we let you go and move on to talking with Allison, and that is that we know that open enrollment's coming up, and you talked a lot about the uncertainty. And I think one thing that we've heard and Andrea has mentioned in some of her meetings is that some of the people she's talking with don't seem to understand the urgency that like we can't wait till year end for this because the open enrollment starts in November. And so what is the how are they approaching, how are the plans approaching that with the you talked about the increase in premiums because of the uncertainty, but what about the fact that we don't know whether these are going to be extended and open enrollment's coming up soon?
Yeah, I think that even though the expiration doesn't happen till at the end of the year, insurers had until this week to submit their rate filings. Now, some states allow for multiple rate filings, with or without the enhanced premium tax credits, but insurance departments at the state level, the insurers themselves, have to lock down their rates. And so the rates are going to be higher. That's going to further discourage enrollment, irrespective of what happens with these tax credits. And that's going to affect the risk pool and make coverage unaffordable. But when people during open enrollment look to buy marketplace plans or re-enroll in marketplace plans, they're going to face big sticker shock because they're going to see what the premiums are without the enhanced premium tax credits if they hadn't already been extended when they get to open enrollment. And so a lot of people will think, oh, I can't afford that. I'm going to drop my coverage. And there won't be a guaranteed special enrollment period if, let's say, Congress acts in January or at the end of December to extend these tax credits where people can re-enroll if the open enrollment period is already over. There are certain special enrollment periods, but there won't be one that's set up unless it's required by the extension that allows people to re-enroll then. So this is going to be a real chilling effect on enrollment in the marketplace. And as a result, people could lose, not just health coverage, but of course access. And we know that people who are uninsured forego needed care across the board.
Great. Well, thank you very much. I really appreciate it. And we will share your slides. They're very helpful, and we appreciate your sharing your expertise with us.
Thank you so much for having me.